I must say I'm privileged really to be here for two reasons. Aged care is such a critical area, and I'm speaking to the converted when I say that aged care is really where the future of medicine is going to be down the track, just because of the sheer numbers that are coming through and the responsibilities that are placed upon us to provide good quality aged care and care to the older people of our community. And you're going to hear an awful lot about that. I'm privileged because in general practice a lot of my work is aged care, and I'm effectively an aged care provider at home because we have my mother-in-law living with us who gets basically full-time care, and we're lucky that we're in a position to offer her that. But it brings me into contact with a whole raft of different people who provide the most wonderful care to a old 84-year-old lady who is totally dependent these days. However, what I want to do first and foremost is to perhaps introduce you to what Medicare locals are, because I know that there's a lot of confusion. There's a lot of confusion amongst doctors, and there's a lot of confusion amongst general community. Now, I'm in trouble right from the start here. Medicare locals are basically independent groups. They're constituted bodies run by a skill-based board that take money from the government, or the government gives us money, and we have to use that money for the better good of our community. And we are answerable because it's public money, so we have to be answerable for how that money is spent and what sort of effects we can bring about. The objectives of a Medicare local are very clear, and these are the objectives that we've taken on because these are auspiced by the government. And you can see there that what we are doing today is heart and soul of what Medicare locals are all about. And that is about trying to integrate the care that is delivered to patients as they navigate their way through the various medical services and primary care services that are available in our community. So it's about coordination and integration, trying to get rid of the waste, trying to make people's journeys relatively easy, painless, understandable, particularly focusing on those people who struggle, the health illiterate, those who come from perhaps poorer socio-economic areas, lower levels of education, whatever. We are also auspiced to provide support to the practitioners, whether they be the GPs or the allied health practitioners or others who are involved in the delivery of health care and primary health services across our area. We also are there to try and identify health needs. What is it in our area that is particular to our area that is not being delivered? And then, having recognised that, what can we do about it? We do not intend to be service deliverers, by and large. We want to work with players who are already in the patch, those who already have capacity and experience, but we want to work with them. We want to develop partnerships and we want to coordinate those sorts of things. We also need to be efficient and accountable, both from the money that we do, but we also want to be accountable for what we do to make sure that the activities that we're involved in actually bring about a benefit. So we have a board. We have a board that is school-based, and I apologise for one oh no, it's been corrected, Jan Child. Didn't have it misspelt there originally. We have a school-based board. Some of these people you may recognise, some you won't. We have an amalgam of people that cover mental health, disability, primary care, local government and general practice. So we have a board that is well represented and a board that are very active in this area. These are the aims of our particular Medicare local. This is what we've sat down and decided. These are the important things for us. And you can see that our main aim is to provide high quality primary health care that is both accessible and coordinated. And I think accessible is important, coordinated is also important. High quality primary care. The structure I've mentioned and the activities down there are the activities that we believe are critical. We want to do targeted impact work, stuff that's going to make a difference. It's going to be based on evidence, and I know Helen's following on from me, and if you want a guru about population health, Helen's your girl, and she's providing us with all the evidence we need, recognising where are the hotspots in our area that are missing out. It will be partner co-designed where possible, and it will be building on existing relationships and organisations. And like I said before, everything we do, we want to put through robust evaluation to ensure that it is actually making a difference. So these are our priorities for the coming year or so. The first two, providing support to the clinicians and after hours care, medical care in the community, are given. The government has laid this down upon us, so we didn't have any choice about that, but needless to say, important areas and areas that we will take on. The next four are the areas that we have sat down and recognised are important areas for this Medicare local, for the Frankston and the Mornington Peninsula. Mental health, I think every Medicare local across the country has recognised that mental health is a huge area. Ageing really about preventable disease. Keeping people healthy for as long as possible, keeping them independent for as long as possible, and vulnerable children and families. Proactive health and living well, again, preventive health structures. But clearly today it's about ageing. It's about ageing that you're going to be talking about, and I will be looking forward to hearing the results of that. And what I'm pleased to hear is that the representation here, over 50 different organisations, which is extraordinary in itself, covering that full gamut of aged care, from the facility right through to those who are being looked after by their family, to those who are perhaps existing on their own at home, requiring significant support and assistance. So with that, I will wish you well for your discussion. I'm sure that Nick has done an extraordinary job already just getting 100 people together in one room in this area. So I wish you well in your discussion, and I look forward to hearing the results of it. I'm going to hang around for a short while. Look forward to hearing the results about it because, as I said before, this is what Medicare locals are all about, bringing people together, discussing what are the main issues, and more importantly, what is it that we can do about it to bring about some sort of improvement. So, welcome along.